Repeated research tells us that most people who achieve long-term abstinence actually do it without common or luxurious treatment facilities. For example, in one study, it examined the prevalent heroin use among soldiers in Vietnam. When they returned home, they gave up their addiction completely and abruptly. When individuals are motivated to make the change, not only is it more successful, but also long-term. And from a loved one's perspective or a therapist's perspective, evoking this motivation to change is crucial. Researchers know that a common problem with addiction treatment is the use of confrontation. Many people have the perception that addicts are always in a state of denial. This is not always the case. Confrontation actually increases an individual's resistance to change. Research has shown problematic behaviors also increase during confrontational periods of intervention. In one study, just confronting someone to stop drinking actually led them to drink more. And when less confrontation is used, less drinking resulted. The truth is, confrontation and scaring someone straight is ineffective, and lots of research supports this. Confrontation, the use of power or trying to pound views or truth into someone, simply fails and causes greater problems. But these methods are all too common in some AA, NA, and 12-step programs. Some treatment centers even have a name for it. They call it attack therapy or hotseat therapy. And according to one researcher, Miller, who is a strong supporter of a counseling technique called motivational interviewing, has said that there isn't a single line of research showing successful clinical outcomes using confrontation. Is it any wonder that AA reports a whopping 80% dropout rate within the first year, according to Alcoholics Anonymous World Services? It is the motivational factors within the individual that produces long-term and sustainable change. Sure, an addict can be forced into treatment, but sooner or later he must make the decision. And there are scientifically backed methods that evoke this decision within the individual. The University of New Mexico conducted a study which examined different approaches when confronting alcoholics. Researchers determined that successful outcomes and long-term sobriety actually stemmed from the level of empathy employed, not confrontation. In fact, empathy toward the addicted loved one contributed to long-term positive effects up to 2 years following an intervention. This is why the Truth of Addiction System includes a book titled Eliciting Motivation to Change. Loved ones, family members, and friends, and even counselors can elicit this motivation to change by using strategic, empathetic methods. Click here to subscribe for more videos, or click the link below this video for more information.